Well, we have a full hour ahead of us, so I think we're going to go ahead and jump in. Again, welcome to everyone. Thank you so much for joining. My name is Chris Melfi. I'm the policy coordinator here at FASD United. I'm joined by a couple others from FASD United and a couple others from the policy team here. We have Emma Baldwin from FASD United. They are one office to my left, so they will probably be hearing me double. I believe we have Tom Donaldson joining, longtime leader of FASD United. We have Susan Shepard Carlson as well, who leads our policy team. Dr. Christy Petrenko, a member of our board and a huge part of our policy team as well, and Sophie Cece, who we're going to give some great shout outs when we talk about our FASD Awareness Month suite of materials. And Sophie, I might even tap you to give a couple pieces of information on that as well.
Ooh.
The plan for the hour is that we're going to walk through a couple of updates from the organization. That'll be fairly quickly. We'll touch on Awareness Month, as I just mentioned, Hill Day coming up, an Impact Week coming up in September. Emma's going to come on and give us some updates on the white paper and symposium that we have been going through for the last 2 years. They can give an update on what that is, why it is, and what is coming next. And then we're going to spend a good chunk of the hour talking about Fund FASD. You know, what is happening with appropriations, what advocacy looks like right now, and how we can all craft and take advantage of impactful moments. So a few organizational updates. As I mentioned, FASD Awareness Month is coming up in September, and using the QR code on the left and the link right below, you can take a look at the suite of materials that's been developed for Awareness Month, all the ways that you can be involved, all the ways that you can help raise awareness, whether you are an organization, an advocate, a self-advocate, or absolutely anyone in between. There's tons of great information inside of the toolkit, including a bunch of Awareness Month media and templates that anyone can use. And stay tuned for more to be announced on Awareness Day activities from the Policy Center in particular. But Sophie, since you're here, is there anything you'd like to share about the suite of materials that you put together for Awareness Month this year?
Sorry, I muted myself by accident. I would just say for everyone, it's super easy and accessible. I already worked with some affiliates who had just some questions that were super easy to answer. And I tried to make the toolkit as easy as possible with the most amount of information that is needed, as well as the Awareness Month media really is as straightforward as it can be. It's supposed to be as user-friendly as possible so that you can just save it, use it, and be done with it. We don't really have that much time, to do all this media and other things. So I've just tried to make it as easy as possible for everyone. So I would just say, please look into it. Please open the Canva to it. And it is so easy just to take what you need and leave what you don't. And I kind of have done the descriptions and such for you as well. So it's really just a one-stop shop so that you can get everything that you need. And I hope that you use it. And if you do use it, please feel free to email me, or if you want support, we can always do like a 15 to 30 minute call as well. I've been doing those from time to time. So feel free to always reach out or message me if you need anything. So yeah.
Thank you, Sophie. And it's great to see in the chat that there are some individuals and some affiliates that are, busy looking ahead to Awareness Month and how they can bring in sponsorship and new advocates. So that's really great to hear. For anyone who isn't aware, we have Impact Week, which I think is appropriately one of our most impactful events that we have throughout the year. It's coming up at the end of September this year. For those seasoned veterans of Impact Week, you may be used to it being closer to the middle of the month. This year, it will be September 27th through September 30th. We have slightly relocated where we will be holding all of the activities. We're going to be just across the Potomac in Crystal City, Arlington, which is, close enough where most people would still consider it the district. It's right there, very accessible, very clean, very safe. I think it is honestly a perfect space for us, and it's an updated space. It's a bit larger. which is totally necessary this year. If you have any interest in joining us for Impact Week, but you have any questions, please feel free to reach out to absolutely any of the FASD United staff members that are on this call. We'd all be happy to share why we think it is so important, why we would love to have you there, and we can help you in any way that will get you there. As I mentioned, it will be the 27th through 30th at the Hyatt Regency in Crystal City. All of our events are going to be there this year. That includes the symposium event, the emerging researchers, everything with the poster day. At the beginning of Hill Day will start there, and also the gala will be there. We'll be very centralized. There will be some other events and the official schedule for that coming out soon. But again, if you have any questions about Impact Week or Hill Day, please feel free to reach out to all of us. For any of those who are concerned about the new location, the Impact Week Hotel, again, the Hyatt Regency Crystal City is about a 15-minute, maybe less, Uber ride over to the Hill where all of our Hill Day meetings will be taking place. For the public transit minded among us, that's a 45-minute ride on one of the best metro systems in the country, especially if you love some brutalist architecture. Emma will not be taking the subway, the metro for that reason, I'm sure. If you're interested in taking a look at anything on the National Mall or any of the museums, that's only about a 10-minute Uber from the hotel. But again, if you have any questions about this, please feel free to reach out to us. I don't have the exact numbers on registrants so far, but we are, as far as I know, we are definitely on pace to have the most amount of people in attendance, and we could not be happier about that. There still is plenty of time for people to register and to get set up for all of Impact Week, but especially for Hill Day. So if you have any questions, again, please reach out and we can help you get some meetings set up. We can answer any questions you have. We can run over what meetings on Hill Day look like. And we can make sure that everyone is able to have the most impactful week possible. One thing that will be done that week, aside from some great policy work on the Hill, is work on the symposium, which leads to the white paper. So I'd love to invite Emma Baldwin to discuss that a little bit.
Wonderful. Thank you for having me, Chris, and all of our forum goers. The biggest news is that the second paper, version 1.2 of the white paper, is now available on our website. We can go on to the next slide, Chris. And I may be kind of rushing through some of these slides just because I'm going to gauge, what is helpful information and what is not. But it is huge that paper 1.2 is out. It is the second of 3 in this cycle, and I can describe a little bit more about what I mean by that. But our FASD white papers come from the conversations we're having during Impact Week, specifically the FASD Symposium. There are sessions in the symposium where we kind of go over a topic, give some lay of the land, and then really have everybody have their own conversations and give their feedback that goes into this paper and the end result of this paper. So I'll go into how that gets done. But right now, the goals of the project, just so we're familiar with why we even started doing this a couple of years ago, we did it for several reasons. First, by creating continuity, looking at previous strategy that was out there. I'll kind of show the 2009 report and updating that strategy from 15, 20 years ago. So it's creating continuity between the conversations we're having. We're not just having a big conversation, tying it up and saying, okay, we did it, we had that conversation, and never revisiting those topics. This is also to help us generalize a national strategy where policy is a piece of that strategy. So policy is creating that systems change, it's opening doors, it's making things permanent. But this also involves people not doing policy work. So you can get into the FASD movement, into creating progress for the field and community, even if you're not allowed in your role to do policy or advocacy, which I know isn't really the crew I'm talking to right now. But I'm pointing that out because I will encourage folks to look at where policy or unrelated to policy things what you can look at in this paper, what matters to you, and what are your kind of action items in this paper. Also, because we're collecting feedback from over 100 folks in the room, we're capturing their attitudes, their perspectives, and kind of their own priorities. So while we're looking at strategy from 15 years ago, we're capturing what our attitudes are now. You know, do we even care about multidisciplinary diagnosis? If we do we see different routes to diagnosis than just multidisciplinary? Seeing what people think and capturing that. And then to track progress. So we want to see what's changing. We want to be able to compare and contrast, but comparing and contrasting takes more than one piece of strategy. It takes multiple to look across and see that change and see that shift. So Chris, we can go on to the next slide. You'll hear me kind of referring back to this 2009 report. The ICCFASD, so a bunch of agencies, federal agencies, some researchers, a couple representatives from FASD United, then NOFAS, had a meeting in 2009 and created this report out of it. This report included 10 call to actions, and those 10 call to actions are what or calls to action. I kind of end up making that one word. Calls to action are what we are updating, what we are looking at in the symposium. We look at each one for about an hour. We break it down, we have conversations, and we collect what people are thinking about it. And then we use that to update the recommendation to what we think now, what we feel now, what the research says now, update it to the current context. And then you'll see the picture of Heather Carmichael Olson, Dr. Olson down in the corner, who wrote this original call to action and has also been immensely involved in creating the structure, reviewing the materials, and looking at the data and reviewing the final paper of this current paper. So this isn't us going, hey, this is a terrible recommendation. We need to update it. No, these were wonderful, informed recommendations at the time. And even Dr. Olson believes, you know, we are ready for an update. And this is such a great way to expand on that work, bringing people who are outside the agencies, outside of researchers, more individuals, more families, more community serving organizations, and professionals that may not be in the agency space, educators, paraprofessionals, social workers, and the like. We can go on to the next slide, Chris. So these are the original 10 recommendations. I'll pause for just a few seconds. You can kind of see what there are. These are kind of simplified forms. So when you see our updated ones and they're really long, just know that the original recommendations were also really long. They also came with action items that we don't look at as much in the symposium, but you can see continuum of care for both individuals and families, data surveillance, maintaining a national forum. These are all the major goals that were written out by the agencies and researchers back in 2009. And Chris, we can move on to the next slide. Here's just a picture of everybody in the room at the symposium last year. So the symposium that informed this most recent paper, because we have a symposium in the fall, the paper is written through winter, and in spring, summer, the paper is published. At this last symposium, we had about 130 people there participating, which is wonderful. We had about 90 the first year, and we expect a very similar growth this next year with more people participating, more people giving their perspectives, more agency folks involved, more people with FASD involved, and everyone in between. And we can go on to the next slide, Chris. This is what the symposium day looks like. You can kind of see a diagram of the room where there's all these tables, and that little red dot is an engager. So some of you, I know I see in the room people who are past engagers, people who are going to be an engager in 2026. These are people who have been around the FASD community. Most of our engagers have not only done a support group, but have also worked in research a little bit, or have worked in research that allow them to work with people with FASD or birth moms and families. Some of them are kind of agency or institution folks who are very passionate about FASD and go above and beyond in their roles. So we have some really impressive engagers who help facilitate the conversations that day. They are pre-prepared and trained. They make sure everyone's voice is getting heard. They speak up if someone looks confused. Um, and we, as the facilitators, usually me, Jen Wisdall, Heather Carmichael Olson, and sometimes guest speakers, will give some context, recent research on the topic, and then we'll ask a question like, what do you think needs to get done? Usually a little bit more specific than that. And we have people talk. And that talking includes a multimodal activity with building blocks or colorful pieces of paper, buckets, flags. We have a kind of fun activity attached to each one so that if it's very research heavy, people with FASD can come in and use visuals, use more of their feelings and sentiments around certain topics to get what they mean across, without needing to comprehend every piece of research, every piece of context within that hour. So we really try to make it accessible. And then that last piece, you see there's a little QR code at the end of each session. We ask an open-ended question. What is your big takeaway? What do you want people to know? And we leave that open-ended because sometimes we get this specific policy needs to change from an expert. Sometimes we get, I'm afraid of data surveillance and I don't understand what that means. And so this strategy, these action items aren't prescriptive. They're not, this is the way we have to do it. Every organization should follow. Everyone should use this language. But some of it is just capturing attitudes, saying, hey, the FASD community is nervous about data surveillance and what that means. We need to increase comfort around, data collection and let them know what protections there are for people. Some things are really simple like that, and some of them are way more complex, like getting into the weeds of IDEA and specific policies. So we cover a lot in this paper. And Chris, we can go to the next slide. These are the past recommendations and updated recommendations from this last session, or the ones that were just published last week. So you can see this up on our website, and you can see the full recommendation. I won't read them all aloud to you right now. I do hope that you guys will go read it through the paper, and I'll kind of give a little bit. I like people reading through the paper, my favorite way, but I'll get there. But you can see with professional education, it used to be just encourage comprehensive professional education on FASDs and assessment of knowledge gained within multiple service systems. I think that is a good goal, and really, there's not a lot to change of that goal. I think we'd agree with it today, and a lot of people did, but we can define that more. We can define action items a little bit more. We can go, hey, who decides this? Is it the educators at every college deciding whether to talk about FASD? Is it introducing this in high school? Is it requiring, that the Department of Education requires this kind of continuing education? At what level do we enforce this? And so we get a little bit more into the weeds, get a little bit more expertise, because it's not just agency folks and not just researchers in the room. It's people who are on the ground doing the work. So a lot of these are building out systems that disseminate standard curricula, being concerned about that. Where are we disseminating this? Centering living experience and including mechanisms for evaluating awareness in communities. So it's a little bit more, how do we systemize this recommendation? How do we really get it through, get it to the next step? And know that with each of these recommendations, we end up having themes and a list of direct action items, very specific things that organizations can be working toward, that researchers can choose to tackle, that individuals can take part in. So it's hyper concrete the more you read the paper. There's kind of the direct action items, there's themes if you're more of a thematic thinker, and then there's this overarching goal, which is these recommendations. So whichever one works for you, I always encourage you to engage with that level in the paper. And we can go on to the next slide. Thank you, Chris. Here are the updated recommendations from 1.1 and 1.2. So all of our progress so far are six recommendations. What I like to encourage people to do if you have a physical copy of the white paper, that's ideal. Or if you have a digital one, taking notes. With a physical one, I like to treat it like those kind of like the little magazines, the catalogs you would get in the mail right before Christmas, and being a kid and having a Sharpie and circling all the things that I want from this catalog and knowing I probably won't get maybe anything from this catalog, but the act of circling it makes me think about that item. It helps the company market that item for sure. It makes me want the item more. I think back, I remember it. Sometimes I would cut them out and I'd put them in a collage as like, I'm dreaming of a life where I have this, purple teddy bear, or the Barbie dream house. And I like seeing other people go through the white paper and circle the things that I do not want to circle, or I wouldn't touch, or I don't even know where to begin with. Because the more people who are circling these things, each action item will be circled by somebody. It's all about picking one or two action items, picking one theme, picking one recommendation that you feel like I want to focus on, or I'm already focusing on this. Because a lot of what's written out in the paper, there's people starting those projects. There's people who I know are very interested in those things or are subject matter experts in those things. And this isn't us saying, hey, this isn't happening. This is us saying this should be funded. This should be prioritized. People care about this. And so for you to circle it and say, hey, I'm already working on this, and let everybody know I'm working on some of the white paper recommendations, action items, because then we have a shared language for what we're working on. We can see this big old quilt and know that one square belongs to somebody else, and you don't have to worry about it in this square over here. You don't have to worry about it. You can focus on your couple squares. Um, so these are the big recommendations. I very much encourage looking at the themes and the action items, and just seeing what calls to you, what sings to you, what makes you feel like, oh, I'm already doing this. I'm already participating in the movement. And we can go on to the next slide, Chris. These are the four themes we will be working on this year. So the final symposium and white paper of this cycle, and we will be completed with updating all 10 recommendations. So in 2026 at Impact Week during the symposium, we will do on that Monday the first three, session 1 to 3. So supporting families. We've already done an updated recommendation and session on supporting individuals and a continuum of care for individuals with FASD. This one is about families. So how do we support families? How do families access supports? Who's giving these supports out? And then session 2, improving research. There was a list of research priorities that were written out in 2009. A lot of those have made some significant progress, and a few of them haven't. So how would we shift how we're looking at those? How do we celebrate our wins, and point toward, what's next for research? Session 3, National Forum. This one's going to be a little funny because you're going to be putting together what your ideal national forum looks like while in a national forum for FASD, and know that I, as an organizer, want to hear what we could be doing differently. This is the final year in the first cycle. This is the chance to go, hey, we need something new. We need this, but different. We need this and something else to supplement. So it's a good chance to kind of meta think about the event that you're in, think about a possible future event that's totally unlike the symposium. How do we need to be working together and talking together as a field and community? Um, and then the Wednesday of Impact Week, there's a fourth session removed from those first three. And this one's about federal programs. It's different because it is so specific, so concrete, and this might be where the policy committee and people who come to the policy forum, people interested or prioritizing advocacy, would want to be at this one. It includes IDEA, diagnostic barriers, but diagnostic barriers like who do we code, diagnosis to this is where I have the least knowledge of. And in acknowledging that, this is set up differently. It's not a little bit of context and then a big activity and then submitting our feedback. It's somebody presenting for 15 minutes on that really specific topic and then gathering feedback. And then 15 minutes of conversation and then gathering feedback. So it's a little bit quicker, but you get a lot more context. You get a lot more information from a subject matter expert on these items. And I'm really interested to see how, especially folks in policy, receive that session and what thoughts come from it afterwards. Because when we say we can get into the weeds of IDEA and diagnostics and Medicaid and supports, this session is the weeds. So session 4 is the weeds, and I'm excited to get into it despite me not knowing that much about the weeds. And we can go on to the next slide. So here's where we are. In 2024, we did the first symposium and released the first volume, 1.1, that 2025 spring. In 2025, we had a symposium and we just released the paper last week. And then our final meeting, our final symposium for this cycle, we're not stopping here. We'll figure out whether we repeat the cycle, we pause and do something, or we find a next stage. But the final symposium of this cycle is this year in September, and we'll have the next final paper out in spring. And we can go on to the next slide, Chris. Oh, let's actually go back. Okay, because that's where we are, that's where we're going. Really, it's this last session, the last paper, and we will be deciding kind of what's up next. And feedback is so welcome and encouraged. I'm sure we will get a lot in the National Forum symposium session, you know, where we could take this next, what we should be doing, what we're not thinking of right now. And you guys are people who show up to meetings, you know, often more than once a month, because I see a lot of affiliates in here. I see people who are involved in other ways. And what you think needs to happen inside policy, outside of policy, supplementing policy to see progress. I'm open to hearing that. Not just open, I'm really eager to hear what people think we should do next. So please feel welcome to email me, ask me for a short call, to just download ideas or brainstorm. And like I said, I'm going to be kind of planning some supplemental activities, some workshops where we come in and we do some of that catalog circling. And I go, hey, if you're in policy, these are the action items you should really look at. Or, hey, if you're doing research, these are the action items or recommendations you should really look at. And we kind of divvy up and delegate some of these action items. And we go, who is working on this? Is somebody already doing this? Because this is what helps us map out a movement. And it helps us map out a movement in which policy unlocks doors, policy makes things permanent, and everything else has to be carried out by people. And so what people that is or who that is, what institutions are involved, those are the question marks. And our community has the answers to that, but we need to have a shared plan, or at least shared language, shared priorities. And that's what the white paper is for and intended to be. So I'm excited to see what people do with it, what people think of it, where people take it. And you'll probably see me at Impact Week. If you're at Impact Week, you'll definitely see me at Impact Week. And you'll see me back here for other updates on the white paper in the future. But thank you, Chris, for this time during your meeting. And please reach out if you have anything, ideas, concerns, questions, all of it.
Well, thank you so much, Emma. Somebody in the chat, Michelle Traeger, just mentioned that it's, so much data to synthesize, but it is really, really important. And there really is no one better to do that than you and the team that you have that's doing it. I love the way that you make everything so visual, so easy to understand. And there's an entry point for absolutely everyone in the symposium, I think. And it's not just 100 people sitting around admiring a problem, right? We have concrete solutions that come out of it. We have concrete recommendations that we can then package and bring to decision makers, to legislators to show. And I think it's critically important that we're tracking the attitudes that surround fetal alcohol spectrum disorder, prenatal alcohol exposure, and everything, because they have changed and they will continue to change. And we're at such an inflection point now with the way that FASD policy is progressing with the Respect Act, with everything that happened with the Support Act, and with hopefully increased federal investment soon to come, that it's really, really important to know the direction that attitudes are heading, because action follows attitudes so often. So being on top of that is really important. We have Emma here with us now. Is there anyone that has any questions or will be new to the symposium, new to Impact Week, and just has any questions about, what it looks like, how to be involved, if there's anything they can do now to prepare other than reading through? Any questions for Emma before we move on?
I'll also add that if you're not coming to Impact Week, we have the option to act as a reviewer for the paper once it's been written. So if you can't attend Impact Week, you can still get your name on the final paper as a reviewer. And our priority is to leverage perspectives, skills from people who work with us the most, who we have a trusted relationship with, which is definitely everyone in this Zoom room. So if you're not going to be at Impact Week and want to be involved in this still, let me know and I'll send you the form.
Again, thank you so much, Emma. We're now going to move on to a very, very brief overview of, what the provisions that were passed in the Support Act that were from the FASD Respect Act actually do. And the reason we are still talking about this is because these are now public law and are yet to be funded, but they are authorized. So this is what we are fighting for. And many of the things that were authorized through the passage of this act actually touch on some of the initial recommendations from that report that Emma was just talking about. So inside of the Respect Act provisions that were passed is a reauthorization for comprehensive programs for education, training, and awareness on fetal alcohol spectrum disorders, updating those programs, making them more modern and making them more sustainable. Working on developing improved diagnostic and intervention methods that are both evidence-based and culturally appropriate. Building state and tribal capacity to address FASD within states, within local communities, and within tribes. So this isn't just about federal programs and federal funding. This is about allowing states to better address FASD within the systems that already exist in those states. And it allows for the creation of national clearinghouse to inform many different systems of care. The reason that more funding and more investment is needed above what is currently available, which is 11.5 million, and above what is actually authorized in the new legislation, is because the intent has changed. The intent and the heart of the Respect Act was that FASD can now be addressed through a lens of both support and coordination, recognizing that supporting families, supporting individuals is a way of preventing instances of prenatal alcohol exposure and preventing adverse life outcomes associated with it. Of particular interest is that state and tribal capacity building. So strengthening a state's ability to include FASD in existing systems, because as we know, states could be doing more already in areas where FASD is not explicitly named. They just need the ability to go in and determine those specific spots. How can funding that is already going towards things related to FASD, where FASD is not named, be of more use to this community? And it also acknowledges the lack of awareness and gaps in support. But again, the reason that greater funding is needed, besides the fact that it has lapsed for years, it's gone down since initial authorization over 20 years ago. It's because the intent of the comprehensive federal program has grown in scope. As a quick reminder of what is happening in the policy world in and outside of the FASD space, the appropriations battle is still going on. In the House appropriators have already approved their fiscal year 27 labor HHS education spending bill. This is where CDC and HRSA money lives for programs for FASD. The Senate is still writing their version. They're still working on all of their appropriation bills. And the Senate has until September 30th to finish up their appropriations work. If we were to look at a calendar of both the House and the Senate, we would see that the House and Senate will both be back in their states or in their districts between August 10th and August 30th. That means that you can reach out right now for an in-person meeting with their offices, should you like. This is a little easier with your representatives because they are far more local than your senators. Your senators will likely be relegated to wherever they actually live in the state or the capital district. As mentioned, all 12 appropriation bills, there's 12 appropriation bills on each side. They all need to be passed out by September 30th, by the end of the federal fiscal calendar year. Since they're being a little slow this year, as they usually are, it is looking more and more likely that they will need to pass what is called a continuing resolution prior to September 30th. This would be a spending bill that essentially just keeps the government open. Flat funding at the previous year's funding levels until they're able to come together and agree on new funding measures, essentially. What this does is it creates more opportunities for us, right? If the Senate still hasn't completed their appropriation bills, and what we need is for FASD programs to receive greater funding within those appropriation bills, we still have a window of opportunity to influence their decisions. The timing works out also because we have from now until September 30th to schedule meetings both in person for Hill Day, but honestly, more importantly, right now, virtually with your 2 senators and your 1 representative to talk about why funding FASD is so critical at this moment. For those seasoned advocates, you may remember that we would have a big map that would pop up to show all of the different meetings that were happening the prior month with members' offices, and we would list out the different co-sponsors of all of the different iterations of the FASD Respect Act. Moving away from the map and rather just having a large list of names here, since we no longer are looking for co-sponsors, we are looking for really appropriation champions of all kinds, awareness champions. The point is that we're really going back to, and I wish Jen was here because we'd make her do the song and dance, making sure that you're meeting with your 2 senators and your 1 representative. It's truly the most impactful thing you can be doing right now. And over the last month, we were happy to say that advocates from both New York and Virginia have been actively meeting with their legislators. Liz McHugh and other advocates from Virginia were able to meet with both senators from Virginia, both Senator Warner and Senator Kaine, and Teresa Conboy from New York was able to meet with the senators from New York. As always, these meetings are incredibly critical. And if we want to make sure that all of the advocacy, all of the work that was done on the Respect Act matter, this is the sort of momentum that truly needs to continue. So you've taken the 5 minutes it takes to sit down and to go to your senator or your representative's contact me part of their website and ask them for a meeting. Maybe you heard back from their scheduler, maybe you heard directly back from a staffer. And now you're asking, what do we talk about? There's no specific bill that we can point to that we can ask them to co-sponsor. So what are we asking them to do? We're asking them to fund FASD. We're asking them to invest in this community like they have invested in other communities because we know it works, because they've shown their intent in passing the Support Reauthorization Act with FASD provisions in there that they want to update and modernize the response to FASD. And now it needs to happen. So what is the specific ask beyond the fund FASD? We're asking for 3 real things. We're letting them know that they can support families and help prevent prenatal alcohol exposure with fiscal year 27 labor HHS appropriations of 21.5 million for programs for FASD at the CDC. This would be a $10 million increase over what was enacted for the same exact budget line in fiscal year 26. We're also asking for them to continue funding the SPRANS FASD set aside at HRSA for $1 million. This second ask there, that 1 million, is a $1 million set aside at the HRSA, which is an HHS agency, and that this money is used for screening and intervention purposes. And then the third ask there, which is separate because it is not part of the HHS, but is still directly related to the continuum of care for fetal alcohol spectrum disorders, is to fund the FASD Prevention and Clinical Guidelines Research Project, which is a super important project that's been going on since 2022. That is done by the Uniformed Services University Center for Health Services Research. This is, you maybe have heard us talk about this, done through the Department of Defense. And what it is doing, is that it's looking at fetal alcohol spectrum disorder and prenatal alcohol exposure within the military healthcare system, specifically at military healthcare system beneficiaries, with the intention of creating prevention and clinical guidelines that can then be brought to the entire country. What does a continuum of care look like within the military healthcare system, and how can that then be applied to the full population? This is important because the military healthcare system is the largest healthcare system in the country, and it is just one very clear route to getting greater supports and services. This project is close to being complete. The 5 million that is being asked for here would get it over the finish line, essentially, and would make sure that these results are able to get out there and be spread to the entire community. Thank you so much, Liz, in the chat, for letting everyone know SPRANS. It stands for Special Projects of Regional and National Significance. I really appreciate that. Everyone can take a second and look at Liz's perfect explanation in the chat if they have any questions. So these are the asks, essentially. These are what we're having these meetings for. And I know some of this language may be a little specialized. This is the exact language that the appropriators, that legislators are looking for. And I may say appropriators, I really want everyone to understand that when we're saying, hey, it's time to do some outreach, to ask your legislators for meetings, we're talking all senators and all representatives. It doesn't matter if yours sits on the right appropriations committee or not. Right now, it is important to make sure that all representatives, all senators, all members of Congress are aware of just what it is they authorized at the end of last year, and how we can move forward to make sure that what they authorized actually happens and makes it into our communities. So to keep it simple, there were three numbers. We're asking for 21.5 million at the CDC. We're asking for a continuation of 1 million at HRSA to continue that special project related to FASD. And we're asking for another 5 million at Defense to continue and finish the project with the DoD. But why do we need the extra money? If the bill that passed with FASD provisions in there authorized 12.5 million, and we currently, as an issue, are receiving 11.5 million, why are we going back and asking for more money? And essentially, it's because Congress authorized an updated version of what was currently on the books. You can see on the left here that there is current funding, right? There's that 11.5 million at the CDC and a little bit more money at HRSA, which is meant to support alcohol screening and brief intervention programs during pregnancy, public awareness campaigns, and different partnerships meant to prevent instances of prenatal alcohol exposure. The CDC is using that money also to monitor alcohol use and look at different trends. And then again, that 1 million at HRSA is being used for FASD screening and intervention. All of that is currently being done with that 11.5 million current funding we mentioned. On the right, you'll see what the Support Act of 2025, specifically Section 104, which is the FASD Respect Act provisions, you're going to see the new things that have been authorized. So those 3 bullet points on the right, those aren't the only things that have been authorized. Those are the new things authorized that also need to be taken care of. Those are the new things that Congress intends to be taken care of. What's not clear to us is how that's meant to happen with continued funding at the same level, when we know that funding has not kept pace with prevalence and has not kept pace with our understanding of FASD. So Congress has authorized, as we already know, to build state and tribal capacity to identify and support people with FASD and their families. And this can be done through looking at adapting existing funds, expanding the ability to diagnose, and providing training to professionals and educators. It's also new that they've called for grants and technical assistance to go to states and tribes and local governments and any other organization that is doing this work. And they've also called for the evidence-based clearinghouse for FASD. So of everything on the left, the current funding, all those current programs can be seen as a foundation. I think it's a great foundation. The issue is that it's just a little too small to continue the work that Congress intends for us to do and that you all work so hard to advocate for. So essentially what we are seeing here is that the law, what is now law, it widened the mission. It widened the intention of what these programs are meant to do. And now appropriation and investment has to meet that widening.
So, Chris, I just wanted to add some context.
Please.
That provision for capacity building was the intent of our champions, and particularly Senator Murkowski when she wrote the first bill for reauthorization in 2007. So that is, so the intent of that new language goes way back. It was nothing new, but that was the intent. And I have to say, and Chris could probably add more information, we're finding more and more states now because of the Respect Act, even though the funding isn't what we'd like it to be to begin that process. We're seeing a lot of interest from states. And one of the things that I drafted the language for state legislatures to get involved or for an administrative order. One of the things we're exploring is to partner with, it's called the State Innovation Exchange, and they draft model legislation. And so since now we have the authorization, what would that look like for, a model legislation that could, with that organization, how could that be used in all the states? So you've got what we've done, but I think now that we've got the act, we wanna update that. So stay tuned for updates on that.
Susan, while I have you, I want to address one of the questions that came from Sid. He has asked in the chat, do we need a proportionate effort to focus on the larger appropriations that should be funding FASD projects and policy? Do you have any thoughts on that from Sid?
Oh, yeah, although we can't, I think for 27, we certainly, that's too big of an ask. And one thing that I've learned since I began in this is the original bill was 118 million, and there was like 30 some million for the building capacity. And so when you get into this, you have to play the game with their boxes uh, in the appropriations process. But I think this is when you look at what other, and we'll get to that, won't we, Chris, on how other appropriations for, say, Down syndrome or autism have a lot more pop appropriations. But we need right now to focus on the 10 million to begin to start that process for states to do their advisory committee, and I'm looking at all sorts of other options that might bring in, that states could bring in revenue to do that. So, but we can't do that now. Right now, we're kind of boxed in to follow the appropriations process the way it is. I don't know if that makes sense.
But in January, we have a new Congress with new committee chairs and subcommittee chairs who are going to be moving on to appropriations and programmatic discussions about the real money,
Oh, yeah.
not these categorical funds. And what I'm suggesting is that we need to think about getting ready for the January process to begin. Those committee chairs in new roles who've been in the minority and now in the majority are going to try to fix hundreds of things that have been broken. And we're not on those lists as yet. Targeting those likely committee chairs. Nevada folks on the call will know the critical role that Congressman Horsford, for example, is going to play on Ways and Means. Can we target between now and January the committee chairs and then look out at our affiliates and the relationships they have with some of the committee and subcommittee chairs who asking one question in an appropriations hearing: how much of your funding goes for FASD related projects? How much of your funding at the state level is allocated for outcomes that you're tracking on FASD? All we are asked in part is that they ask questions about FASD during those hearings that will begin in January, and there'll be a flood of them. I'm just saying we need to get ready for that, as well as what we're talking about in the States. I don't in any way want to downgrade the categorical items, the 11 million and the 12 million. Those are critical pieces, no question. But the real money is going to be debated in a different kind of Congress starting in January. I'm hoping we can get ready for that.
I would agree with you 100%. And this is strictly geared toward the September, between now and September, where they're writing that bill, and the House has already written their bill. So to get at least a little piece, but you're absolutely right that that has to happen. And I just know Carl is talking about an alcohol tax. There are a lot of people around the country that are talking about alcohol taxes, and that could, I've been doing a lot of research on it, and we all know that alcohol tax has not kept up with inflation, and very few states have been successful in doing that, but maybe a collective effort somehow. That would, and then one of the things, Sid, I think you'd be interested, it could be structured. So whatever is garnered could be a Medicaid, fill Medicaid hole. Anyway, we don't want to get into all that right now, but we're having some discussions about that.
Thank you, Susan. Thank you, Sid. Yeah, Susan, I totally agree. And I think, that's a point we can get to by having more exploratory meetings, I think, with members of Congress and their staff, which we only get to by getting through the introductory meetings, right? A lot of good came out of the pure volume of meetings we had with legislators during advocacy for the Respect Act. Beyond just creating FASD informed legislators and systems, we were able to get into, have relationships with some of those staffers that led to conversations that can lead to the exact sort of thing that Sid is mentioning. So we think about it, journey before destination, right? Take advantage of all the steps to get to that point, to garner and to create and foster these relationships so we can have those sort of conversations that can lead to the questions that are poising being asked in committee, being asked at really, really vital times. We're coming up to the top of the hour. We have a little bit more information to go through. I just want to address something that was in the chat. Maxine had asked if these slides are going to be available to be used as talking points with meetings, and 100%. All of these slides that we're showing here are actually just little snippets from a one-page advocacy document that we have created and will be published soon that is meant to be used specifically in meetings with legislators to talk about appropriations and about funding. So absolutely, these will all be available. If we had just talked about the, why we're asking for more of this money, why the investment is needed, here is some proof that there is a real need for it, but also that there's a model to follow. We all know this information already, right? We all know that the prevalence of FASD is right in that 1 in 20 prevalence with a large lifetime cost and very low federal funding. It may surprise some just to see how little federal funding per impacted individual FASD receives when compared to less prevalent disabilities such as autism or Down syndrome. We know it's the most prevalent and amongst the most expensive, yet it receives the least, right? It's somewhere around $3 per impacted person. And this takes into consideration both programmatic money and research funds. We can take this just a little bit further and look at where that federal funding is for FASD and for less prevalent disabilities. We can see that autism, and this is current federal funding, is somewhere around $345 million, split between the CDC, NIH, and old DoD funding for autism work compared to the $115 million total at Down syndrome. For Down syndrome, they have their own dedicated program at NIH. And then you have the 65.5 million total here for FASD, which includes research money at NIH. It also includes this money that we're requesting. So this is the FASD money is actually inflated here, showing what it would be receiving should the requests that we were talking about are actually put through. Why are we showing this? Not to pit conditions against each other. The point is to show the gap, right? It's to show that there is a model that works. Sustained federal funding for autism support and research has been wildly successful. It's not that autism is overfunded. It's that the funding has done what it tends to do. It's been able to deliver different supports and individuals to families through the CARE Act. It's created different early intervention programs like the model program in Denver that offset cost per child by up to $19,000 a year, completely paying for its own program after 2 years. And they had specific grant opportunities and technical assistance to go to states to allow them to build their capacity to screen and diagnose. This is a proven approach that has already worked across the country, and it's only because of sustained federal support over the last 2 decades. This isn't us pointing to the autism community and other communities as a target. It's not saying that's a zero-sum game. It's really saying we can grow the pie, which is what Congress actually did last year when the president's budget called for cutting huge amounts of money to the HHS and other health services. Congress came back and actually expanded the amount of money that went to all of them. We know this isn't really a zero-sum game, and we also have this model that works to point to and to look at as a playbook. In an attempt to end relatively close to time, we are, of course, more than open to any questions, so we're happy to sit along here for as long as you need to and answer any questions, take any thoughts or concerns, but really want to leave everyone just with the following few thoughts. If you are at all interested in being part of Impact Week or Hill Day, now is the time to register. You have plenty of time, but the earlier the better for Hill Day so we can help you get sorted out. I just want to remind everyone, I know I already said it, we'd like to think of it more as journey before the destination in this case. So yes, Hill Day is fantastic. It's bringing everyone together. It's great community and it's something great to look forward to. And Hill Day is much, much more impactful when those meetings can be exploratory rather than introductory. When it's you meeting face to face with either the member that you've already spoken to online or members of their staff that you've gotten a chance to meet with. I encourage everyone, if you have time right after this meeting, to go to your two senators' website and your one representative's website to their contact me page and request a meeting. If you don't want to do that, give me an email and I'll see if we have an email address directly for their scheduler. But as we mentioned, it's really, really important that we keep momentum up and that we keep contact up. And as that, I think that plays into Sid's point that we need to make sure that we're front of mind for the legislators, for the appropriators, for everyone who is making decisions for when their agendas change in just a few months. And then I would ask that you coordinate with us if you are able to attend meetings. We realize that this can be sometimes an overwhelming process, sometimes a confusing process. But what we have found, and I think this is true for everyone over the past 5 years or so, is that this sort of advocacy works better when everyone is working together and looking to support each other. We are more than happy to help in any way. And that includes attending meetings and helping to set up schedule meetings. So we would be more than happy to help coordinate in any way possible. As mentioned, all of the information that we just went over and a lot more will be ready for all of you to see very, very soon in our one-page document. But if you have any questions in the lead up to that, after this meeting, tomorrow, anything like that, of course, feel free to reach out. My cell phone number is in the chat somewhere, and you can also email me anytime at melfi@fasdunited.org. And I know the same goes for all the other FASD United staff members on the call. Again, thank you all so much for being here. We really, really appreciate it. I'm going to go ahead and stop share. So if anyone has any questions, we can hang around for a little bit. But again, thank you so much and so happy to see everyone join us for July's policy forum.